You mentioned that you have a 3-week-old son, and first off, congratulations on that. And you have a question about breast pain. You mentioned that when you're nursing him on the right, it hurts on the left side, and when you're nursing him on the left, it hurts on the right side, and you're wondering what this could be due to. I had a few different thoughts. There's many different possibilities. One is letdown. When you latch your baby on, the milk doesn't immediately start flowing. You'll probably notice that your baby sucks for anywhere from like 30 seconds to a couple of minutes, and then all of a sudden they start actively swallowing because the milk is now flowing. This is called a letdown, and your body actually releases a hormone that releases the milk and lets it come out. For some women, letdowns are a little bit painful. It can cause like that pins and needles sensation. And if this is what you're feeling when the milk lets down, then that might be an explanation for the pain you're feeling. And the letdown can be felt on both sides. It doesn't matter which side the baby's latched onto. Some women even have milk spill out of the breast that the baby's not latched onto, and so you have to put like a nursing pad there to stop it, or apply a little bit of pressure with your other arm. This is normal. But there are other things that can cause breast pain that are not normal. One is engorgement. This is where one side is full and needs to be emptied, and it causes pain. So make sure that you're alternating the side that your baby starts nursing on. Let's say that at 9 a.m. you start your baby on the right side. And it's good to feed your baby on both sides during each feeding. So you start on the right and then you feed them on the left. But then let's say they want to eat again at noon. You start them on the left and then feed them on the right. And keep alternating the side that you start on. And this will help to make sure that both sides are equally stimulated, that they're both good milk producers, and that one side doesn't get overfilled. If these things don't help, then it might be an improper latch. This is actually one of the most common causes of breast and nipple pain when it comes to breastfeeding. Maybe the baby has a shallow latch, and look at the nipple, the shape of it, and the color when your baby detaches. If there's like a white crease in the middle, then that is probably due to a shallow latch, and just see if you can get your baby to take more tissue in when they're sucking. If it looks like a tube of lipstick, they're also not latching properly. The nipple should still be nice and round, a nice flesh color after the baby's detached. And if you notice that your nipples are cracked, sore, bleeding afterwards, then that's not normal. You don't have to endure it. And I do suggest talking with a lactation specialist. They can actually watch your baby nurse and see if any adjustments need to be made and make breastfeeding a successful experience for you and your baby. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.